Now we'll see one of the cardiovascular related disorder, that is angina. So angina is a serious cardiovascular disorder where there is insufficient oxygen supply to the heart, or else if there is any increased oxygen demand to the heart and decreased oxygen supply. So then that leads to a chest pain. There occurs chest pain and there occurs some sort of discomfort in the heart. So this situation is called as angina. What are the symptoms we can see if a person is having angina? First thing is that there will be severe chest pain and the person will have difficulty in breathing. There will be shortness of the breath and there will be light headache. The person will have light headache and sometimes the person may even faint also, and there will be severe cold or sweat or either it may be severe cold or the person may sweat a lot, and there will be anxiety, nausea-like symptoms, and rapid or irregular heartbeat. The heartbeat will not be in a regular pattern and there occurs pale coloration of the skin. Let us see what are the classification of angina. What are the types of angina? So this angina is divided into 5 types. First one is stable angina or classical angina, unstable angina, atypical angina or prinzmetal angina, microvascular angina, and the other one is variant angina. Now let us see stable angina. So the stable angina is occurred because of the blockade of the arteries, or because if there is any blockade or narrowing up of the arteries due to atherosclerosis. So because in the atherosclerosis condition there occurs deposition of the cholesterol or deposition of the lipids and triglycerides at the walls of the blood vessels. So because of this the blood vessel gets narrowed and thereby the blood supply will not be proper. So in this condition that leads to the stable angina, and then this occurs when there is exertion or effort. So if there is any effort in the blood flow or if there is any difficulty in the blood flow, then this condition is occurred, and the pain which is caused because of the angina is on regular basis, or the pain which is occurred is same. So if a person is having some sort of pain, the same pattern of pain is the same, and it is where it stays for a short period of time, and this is relieved by using anti-anginal drugs, or if a person takes rest also, this kind of chest pain or angina can be relieved. The other one is unstable angina. So the unstable angina mostly occurs if a person is even at rest also. So here if it is more severe and lasts for longer than the stable angina. So even if a person is having atherosclerosis or any cardiovascular related disorder, if a person is even taking a rest also, in that condition this chest pain may occur. So this chest pain may occur because of the various cardiovascular disorders, and the pattern of pain or the pain with which, or the stroke which is getting to the heart is not the same. So this pain is not predictable also, and it stays for a longer period of time. So when compared to stable angina, this is staying for a longer period of time, and it can be easily caused during exercise also. And if a person is doing over exercise, and because of the exercise the body uses more amount of oxygen, sometimes because of the excessive utilization of the energy there may be decreased supply to the heart, and thereby it leads to this unstable type of angina, and this need to be immediately treated. The other type of angina is variant angina or prinzmetal angina. So this type of angina also even occurs at the rest, and we have to observe these kind of patients. So because we cannot say when this type of chest pain can occur, and they should be relieved with only anti-anginal drugs, and this can be seen in most of the people who are prone to atherosclerosis. So in severe atherosclerotic condition, if there is any narrowing of the blood vessel, then this variant type or prinzmetal type of angina can be observed. The other type of angina is microvascular angina. So this is a type of angina which is occurred because of the narrowing of micro blood vessels. So if here in previous type of angina, the narrowing up of the major blood vessels occurs, but here in this type of angina, even the normal or even the major blood vessels are working properly, and even the minor blood vessels are getting narrowed, then that leads to the severe discomfort in the chest, and that leads to the microvascular angina. And here it is treated with common anti-anginal drugs. So here we can see the pictorial representation how the blockade of the blood vessel is taking place. Here the blood vessel is not blocked completely, only to some extent, or the blood vessel is blocked partially, and thereby the blood flow is not proper when compared to the normal blood vessel. Atypical angina. So atypical angina is a type of angina which causes some sort of pain, which does not cause pain, but it causes some sort of discomfort. The person will not feel that comfortable. So there won't be any chest pain, but there is some sort of discomfort occurring in the person, and because of that the person can't breathe properly. There will be difficulty in breathing, and the person will become tired, and the person the person will have proper the person will not have proper digestion. There will be indigestion, and the women category of people are more prone to this type of angina when compared to men. Here we see the pathophysiology of angina. The oxygen demand is more when compared to oxygen supply. So here the oxygen supply is not proper, and the body or the heart is demanding for oxygen. So in this condition, the oxygen or else the angina can occur. Let us see what are the factors influencing in the anginal condition. Here, if we see if the ventricular pressure and ventricular volume are increased, then there occurs contractility of the heart. So if the contractility of the heart is more, then heart rate is more, and if the heart rate is more, then the wall tension. So wall tension is more. So in all these conditions, the heart works properly, and thereby the heart functionings are affected, and thereby the heart is demanding for oxygen. And if we see the duration of diastole, the duration of how much the diastole is there, and the aorta diastolic pressure, the diastolic pressure which is present in the aorta, and the coronary vascular resistance, the resistance which is exerted by the coronary artery to the blood flow. So all these factors aid in the differences of the oxygen pressure, or all these factors, they aid in the differences of oxygen supply to the heart, and thereby that increases oxygen supply. So here the oxygen demand is more than the oxygen supply. All these factors aid in this aid in this imbalance of oxygen supply. So if we see how can we measure the amount of oxygen, how can we say that this amount of oxygen can be supplied to the heart? So if we see, we can be measured by the two products. One is double product and the other one is triple product. So if we multiply heart rate and systolic blood pressure, so we have to measure the heart rate and systolic blood pressure. If we measure and if we multiply these two, whatever the result we get, that much amount of oxygen has to be supplied to the heart. And the other type is that triple product. Here the systolic blood pressure, heart rate, and even the ejection time. So the ejection time of blood, or the pumping out of the blood from the heart, that time has to be measured, and these have to be multiplied in order to get the oxygen consumption, or how much oxygen is consumed by the heart. What are the diagnosis tests for angina? So routine tests like the ECG, we have to measure the ECG, and stress test, we have to measure the how much stress the person is going on, and echocardiogram, nuclear stress test, and blood test. So all these are the routine tests which are to be conducted in order to diagnose angina. And there are rare tests or optional tests. In severe conditions only we can go for this test like X-ray, we have to go for the chest X-ray, and coronary angiography, and CT scan. What are the risk factors, or what are the factors which are aiding in the potentiation of the angina? The age group, as the age is increasing, then those people are more prone to angina. And alcohol consumption, people who are smoking, and people who have diabetes mellitus, elevated serum levels, high blood pressure, and family history, who will get angina from hereditary, from their ancestors, and obesity, lack of exercise or physical fitness, sedentary lifestyle, stress, and gender. So all these people, or all these age groups, or all these persons are prone to angina more. So what are the causes of angina? Why angina is caused? So angina is caused in addition to various diseases like coronary heart disease, if the coronary artery of the heart is blocked, and coronary artery spasm. So if the coronary artery is in the contracted state for longer period of time, and atherosclerosis, deposition of the lipids in the blood vessels, and inflammation of the coronary artery, injury of the coronary artery if there is any damage or cut to the coronary artery, and microvascular angina. So all these can lead to the anginal conditions. Let us see the treatment of angina. What are the treatment given in order to treat angina? So first thing is that non-pharmacological treatments like loss in weight. The person has to lose weight. So because of the overweight, there occurs obesity and atherosclerosis which are leading to angina. So the person loses weight, and the alcohol intake and smoking intake has to be reduced. The person should smoke less, or alcohol intake should be reduced, and the person should be physically fit. The exercise should be, or the person should do physical activities on regular basis, and lifestyle should be proper. There should not be a sedentary lifestyle. That should be in a proper manner. So these can prevent angina to some extent. And if the person is having angina, what are the drug treatments we have to give? So there are various drugs like nitrates or nitrates or organonitrates, beta blockers, calcium channel blockers, potassium channel openers, and various other drugs. So let us see the classification of anti-anginal drugs. First category of drugs are nitrates or organonitrates. So here the drugs which come under this category are short-acting drugs like the glyceryl nitrate or nitroglycerin, and long-acting drugs like isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate, and pentaerythritol tetranitrate. If we see, these are the structures of nitroglycerin, which is having a nitro group, NO2 group in the structure, which is the main compound which is showing the anti-anginal activity. If you see here the mechanism of action, the nitrates, they aid in the release. From the nitrates, we saw the nitrate structure. So from the nitrate structure, they release NO, that is nitrous oxide. So this nitrous oxide, what does it do? It converts the guanylyl cyclase to cyclic GMP. Here the GMP, guanylyl monophosphate, is converted to cyclic GMP, and the cyclic GMP levels are increased. So if the cyclic GMP levels are increased, then calcium levels are decreased. So the cyclic GMP won't allow the calcium to enter into the cell, and thereby the intracellular calcium level is decreased. So if the intracellular calcium level is decreased, here there is a myosin light chain kinase. In the muscles, there is a myosin protein. So here the myosin light chain kinase which is there, myosin light chain which is there, it is getting converted to myosin light chain phosphate. So it is converted to phosphate form with the enzyme called as myosin light chain kinase. So the calcium will aid in this conversion, and thereby if the myosin light chain kinase is converted to phosphate form, then it leads to contraction. And if the phosphate is removed and it is again converted to myosin light chain, it leads to relaxation. So if it is in the phosphate form, then occurs contraction, and if it is in the non-phosphate form, it occurs in the relaxation of the muscle. So these nitrates, they aid in the relaxation of the smooth muscle, leading to the severe contraction, and thereby the angina can be reduced, or the narrowing up of the blood vessel can be reduced. The other class of drugs are beta-adrenergic blockers. Here we have the non-selective agents and selective drugs. Like non-selective drugs which include propranolol, nadolol, pindolol, thimolol, and labetalol. And selective beta-adrenergic drug, beta-1, especially beta-1 drugs include metoprolol, etinolol, esmolol, and acebutolol. So here these beta blockers, so these are the receptors which are present in the adrenergic system. So here beta 1, beta 2 and beta 3 receptors are there. Especially beta 1, non-selective in the sense they can bind to any of the 3 receptors. Selective beta 1 in the sense these are the drugs which only bind to the beta 1 receptors. So these drugs, they won't allow the adrenaline or noradrenaline to bind to the beta receptors. So if adrenaline goes and bind to the beta receptors, it shows contraction of the blood vessel. But if they block the action of the adrenaline, then the over contraction of the blood vessel can't take place, and thereby the blood flow is in the proper manner. The other type of drugs are potassium channel openers. So potassium is such an ion which is entering into the cell, causes or else it inhibits the depolarization of the cell, thereby the muscle relaxation takes place. So the drug which come under this category are diazoxide, minoxidil, minacidil, as well as nicorandil. So potassium, what does it do? The entry of potassium into the cell, it prevents or inhibits the depolarization. So if the cell is not undergoing depolarization, it undergoes hyperpolarization. Because of the hyperpolarization of the cell, there occurs relaxation of the smooth muscle. So these drugs, they open the potassium channels, and thereby the entry of potassium channels is allowed into the cell. So here we can see the potassium channel openers, they open the potassium ATPase pump, and thereby the potassium comes inside, and there occurs hyperpolarization of the cell. So if the potassium is more, then calcium levels are decreased, and that causes smooth muscle relaxation. The other class of drugs are calcium channel blockers, and these calcium channel blockers are further divided into phenylalkylamines, benzodiazepines, and dihydropyridines. The drug which come under this category of phenylalkylamine is verapamil, and diltiazem is the drug which belong to the category of benzodiazepines, and these dihydropyridines are further classified into first generation, second generation, and third generation drugs. First generation drug include nifedipine, second generation drug include istradipine, nicardipine, and felodipine, and third generation drug include amlodipine. So these drugs, they block the entry of calcium into the cell. So if the calcium is entering into the cell, it causes depolarization of the cell and contraction of the smooth muscle occurs. So if the calcium, this calcium channel is blocked, thereby the calcium entry is not taking place into the cell, and that causes smooth muscle relaxation. There are various miscellaneous drugs like dipyridamole. So dipyridamole is a coronary dilatory agent. So it dilates the coronary arteries, and it even does not alter the ECG effects also. The ECG changes are not even altered by this drug. This drug acts by inhibition of platelet aggregation. So it inhibits the clot formation. So even if there is any clot formation, so in the artery, if there is any thrombus, so if there is any clot formation occurring in the artery, then that leads to the blockage of artery or narrowing up of the artery. So this type of situation, it is inhibiting the platelet aggregation, or else it dissolves the clots which are present, or else, it does not dissolve the clot which are present, but it will prevent the new clot formation, and thereby the oxygen supply can be proper. And it is mainly used in the prophylaxis of coronary as well as the cerebral thrombosis, which is, in the myocardial patients, in the post-stroke of myocardial patients, or the persons who are having myocardial infarction before. So in these people, this drug can be used as a prophylaxis of coronary and cerebral thrombosis. The other one is trimetazidine. So trimetazidine acts non-hemodynamically. In the sense, this drug will prevent the deposition of fatty acids. So here, because of the fatty acid deposition, so unsaturated fatty acids which are there in the body, they get deposited in the blood vessel, leading to the narrowing up of blood vessels. So here, this drug prevents the degradation of fatty acid. So the fatty acids are degraded, it forms triglycerides, and thereby deposition occurs. So it prevents this type of degradation, and thereby it is preventing the acid to get deposited in the blood vessel, and it reduces the myocardial oxygen demand by acting through the by inhibiting the by inhibiting the fatty acid peroxidation. It also inhibits superoxide toxicity. So superoxide is a free radical. That is H2O2 is an hydrogen peroxide. So here, if an oxygen is removed from the hydrogen oxide or hydrogen peroxide, then it leads to superoxide free radical. So this superoxide, it causes toxicity to the cell. So this drug, it prevents even the superoxide toxicity, thereby it is preventing the ischemia of the heart. The other drug is ranolazine. So ranolazine, it inhibits the sodium current. So even if sodium is entered into the cell, it causes depolarization of the cell, leading to the cardiac arrest for longer period of time. So it inhibits the sodium channels in order to prevent the contraction of the heart, and even it reduces the calcium load on the heart. Even the calcium entry into the cell and calcium influx can be reduced, and thereby the calcium load on the heart can be reduced. Not only it is acting as an anti-anginal drug, it is also So it is also showing cardioprotective effect. So it is showing cardioprotective effect by inhibiting the fatty acid oxidation. So if the fatty acid oxidation is done, then that leads to ischemia of the heart. So this fatty acid oxidation can be prevented by this drug, and thereby it is acting as a cardioprotective drug, and it does not alter heart rate and blood pressure. So this drug acts in such a way that the heart rate as well as the blood pressure cannot be altered at all. The other drug is oxyfedrin. So oxyfedrin is a drug which is undergoing, or else we can say it is claimed to improve myocardial metabolism. So it is such a drug which is improving the metabolic capacity of the heart, and thereby it is sustaining the hypoxia condition. So hypoxia is a condition where there is decreased oxygen supply. So here if the heart is undergoing metabolism properly, and thereby the oxygen supply will be more. So here it even it can diminish or it even alter the taste sensation. So this drug is having a capacity to alter the taste. So the taste won't be as normal than it is going to be. So if we see what are the various effects which are produced by these class of drugs are, the nitrates show the effects like if they are if they are administered into the body, they cause a smooth muscle relaxation, they reduce the preload on the heart, even they reduce the afterload on the heart, and redistribution of the coronary flow. Whatever the coronary flow which is occluded, that will be regained again. And these drugs have the side effects like they'll have severe headache and methemoglobinemia. This is a condition where methemoglobin is formed, where it is reducing the function of the RBC, and if the RBC are not functioning properly, then there occurs, the oxygen will not be supplied properly, and there will be rare rashes, palpitations, there will be disturbances in the pulses, and it causes weakness. And these drugs should not be given, or they should be contraindicated with sildenafil. So sildenafil citrate is a drug which is a phosphodiesterase inhibitor. And hypotension condition, myocardial infarction condition, and vasodilation. So in all these conditions, nitrates are not preferred. The other class of drugs are beta blockers. So beta blockers show the action of decreased heart rate. They causes decreased force of contraction of the heart, and they even causes decreased conduction of heart. So the impulses which are conducted in the heart can be reduced, and it decreases myocardial oxygen demand. So the demand for oxygen of the heart can be reduced, and it improves ischemic conditions. So whatever the ischemic conditions are, that can be improved, and this is betterly useful in congestive heart failure and migraine. And if we see the side effects, it causes decreased work capacity. So the capacity of the heart to work can be decreased if it is used for a longer period of time, and it causes fatigue, it causes loss of libido, nightmares, and it increases triglyceride levels as well as LDL levels. And it should be strictly contraindicated in bradycardia condition, prinzmetal angina, coronary obstructive pulmonary disorder, and dyslipidemia, pheochromocytoma, smokers, and the person who have already taken medication for hypertension. So in all these conditions, beta blockers are strictly contraindicated. The other class of drugs are potassium channel openers. So potassium channel openers, they cause smooth muscle relaxation. They relax the smooth muscle, and they even cause myocardial stunning. In the sense, they decrease the myocardial stunning. In the sense, the the contracted state of the myocardial tissue can be reduced by these drugs, and there will be increased blood flow in the coronary artery. And it causes side effects like flushing, there occurs flushing or redness, and it causes palpitation, weakness, headache, dizziness, and nausea, and even painful ulcers in the stomach or mouth. So here the ulcers may be formed in the mouth, and these should be contraindicated with anti-diabetic drugs. The calcium channel openers. So these calcium channel openers are very cheap, and they are, in the sense, they are very affordable, and they are better used in anti-arrhythmia. So the drug called verapamil, it is very useful in arrhythmia condition, and they are used in even vasospastic angina. So the angina which is caused because of the spasm of the vascular tissue. The side effects of these drugs include they retain the fluid, so they cause the fluid retention. The excessive fluid retention takes place, thereby that leads to increase in the blood pressure, and they even worsen the condition of congestive heart failure. So these drugs should not be given in congestive heart failure condition, and they causes gastroesophageal reflux. The gastric contents will be regurgitated or moved up into the esophagus, leading to the esophagus ulcers, and it will cause edema or inflammation in the ankle region, and there will be difficulty in bladder voiding. So the bladder emptying will not be proper, and these drugs should be contraindicated in the condition of tachycardia, arrhythmia condition, congestive heart failure, and even the volume overload which is caused because of the beta blocking drugs.